We met in London. I mean, years ago I was doing my training in London, and I met Mohammed socially as much as anything else. He had the inspiration to set up an organisation because we had a common interest, and because we got on so well at that time. He asked me to become part of it. I did have some health conditions at that time, and I suppose we were all motivated by self-interest. And what was being said, there was an ability to help me sort of as part of that process. So again, I could see something that was going to be important for me. Running from a semi-detached property in Birmingham at one stage, and then it had its new home in a slightly different part of the same area of Birmingham, again, which is a larger property, and it actually had its own property. That property had to be refurbished, and there was an awful lot of work had to go into that property, and there was a lot of headache involved with that, but with a lot of commitment by the people involved, the actual property could actually happen. And that was the first building that was given to Freshwinds, and that was when the charity, which was an entity then, was actually running, and that was from that part of Birmingham basically. So, okay, you got a charity, you got an entity, and and you say, okay, what do we go from here? So we got the building, and then it was really much the case, okay, let's try and develop the work of the charity to try and facilitate, how we're going to make this happen. And again, it was led by the target groups of who we were helping. Some of the target groups in those days, again, you're looking at the early 90s, and one of the target groups which influenced HIV's development, influenced Freshwinds' development, was the work around HIV in those days. I'm sitting here today, we're living in an age where HIV can be managed as a long-term condition. Again, there's responsibilities with that. In those days, those medications were not available. They were still in their infancy and unproven. And again, people were not living the way they are to this day. And some of the work that we were doing were helping people living with HIV at that time and facilitating services within Birmingham in joint partnership with other services within the city, just helping those services. That was one of the areas where it started. The other main influence where the charity started was on its belief and its commitment to complementary therapies, which is the official term. Some people would regard them as alternative therapies. But again, therapies that were developing at that time, there were therapies that involved sometimes homeopathy, reflexology, other therapies I could mention. And again, it was to use those in a therapeutic process that could actually facilitate the help of other people, basically. Again, there wasn't any set prescribed way that could be done. There was, on the medical side of things, especially on the official medical front, there wasn't always well received by some people. So you're having to sort of face that, but they were having to sort of challenge a sort of situation in the city where complementary therapies were considered fluffy and not always effective, but they were considered to be helpful. When you're looking at an organisation running from a building, you're looking at operational costs, and you're trying to make that organisation financially viable, and that is difficult because you're having to access money. And I don't have a fundraising background. I work within the medical sphere. I work within the NHS. That's my background, and that's not to do with fundraising. So in a sense, you were making it up as you went along. But you apply yourself, you do the best you can, and we did succeed. Sometimes in very difficult circumstances, to be fair, but we did succeed. I want to sort of pause to remember those people from that time who aren't with us now, and in particular to remember Keith, and who was part of the charity at that time. Unfortunately, he isn't with us now, but he was part of us now, and I suppose he will always be part of the charity because he was there at that time. He never lost sight that the charity, as was then, was always going to be something very important, but in a sense the inspiration for the charity was very much resting on his shoulders, and he was having to sort of facilitate that on a day-to-day level. And again, if times are hard, sometimes being able to sort of maintain people's commitment to that can also be hard. There's a part of you will never stop learning, and I think part of the charity is also to say that it continually grows. I sit in the charity to this day, and it's a very different organisation to when I when I left the charity at that time to go into other work, full-time work within the NHS, and it is a very different journey that they've had to undertake at that time. It doesn't mean to say that journey was without its problems either. So what? You've got to carry on, and you just keep. And I think the core belief has always been there, and that belief has been shared by other people along the way. And it's again that core belief. Call it spiritualism, call it belief process. It's worked for the benefit of the organisation as a whole. I would not be sitting here without the help the charity has provided me. I would have been. I just would not be here, basically. So I'm always grateful to the charity. I hope the charity has also benefited a bit from my input as well. But and I wish it every success for the future as well, at this time when we're just actually reflecting on where it's been and also where it needs to go for the future as well.